Vitamin B12 deficiency is more common than you might think, and if left unchecked, it can lead to serious neurological and hematological issues. In this video, I will explain the key causes of B12 deficiency and give you a simple, effective way to memorize them using ABCD's mnemonic. Let's get started. All right, so our medical mnemonic begins with the letter A, implying autoimmune. So we're going to start with one of the most classic causes of B12 deficiency, and that is pernicious anemia. This is an autoimmune condition where the immune system mistakenly targets the parietal cells of the stomach, the very cells responsible for producing something vital, the intrinsic factor. Parietal cells also makes hydrochloric acid. Without intrinsic factor, vitamin B12 cannot be properly absorbed, simple as that. But before even vitamin B12 gets to the intrinsic factor, it binds to something called haptocorins, okay, which is also referred to as R binder or R protein, which is secreted by the salivary glands and also in the stomach. Think of R binder as B12's bodyguard, shielding it as it travels through the stomach's acidic battlefield. Now, here's the twist. Although the intrinsic factor is produced in the stomach by the parietal cells, it doesn't bind to vitamin B12 there essentially. Why? Because you can see that vitamin B12 is tightly hugged by the R binder. The real handoff happens in the duodenum right here. Okay, and this is where enzymes from the pancreas, specifically protease, step in and then they break the bond between the R binder and vitamin B12. By so doing, it frees up vitamin B12 so that it is able to bind to the intrinsic factor. So what happens if there is an exocrine insufficiency in conditions like chronic pancreatitis where proteolytic enzymes are reduced? That is, the vitamin B12 R binder handshake never breaks up and intrinsic factor never gets the chance to bind to vitamin B12. So what is the end result? There is going to be poor vitamin B12 absorption. Now, once vitamin B12 is finally bound to intrinsic factor right here, the duo travels to the terminal part of the ileum, right there. Okay, that's the final part of the small intestine where B12 is absorbed through specific receptors. And from there, vitamin B12 is picked up by transcobalamin 2. Transcobalamin 2. Okay, and transcobalamin 2 is going to help transport vitamin B12 through the bloodstream to tissues that need it. And here is an interesting clinical pair. So think of another transcobalamin, which is transcobalamin 1. In fact, transcobalamin 1 is the same as haptocorrin. There is also transcobalamin 3. These types of transcobalamin is actually synthesized by white blood cells. Okay, so this means that in conditions where there is leukocytosis, like certain leukemias or myelodysplastic syndrome, the transcobalamin levels can actually be elevated and it can create a scene as if vitamin B12 is also elevated. So it is not always a marker of healthy B12 status. This is why myelodysplastic syndromes can often resemble vitamin B12 as well. Another important cause to remember is atrophic gastritis, a chronic condition where the cells in the stomach, including the parietal cells, waste away gradually. As these cells atrophy, what happens is that they lose their ability to produce intrinsic factor, which is the protein essential for transporting vitamin B12 to the terminal ileum. No parietal cells means no intrinsic factor. No intrinsic factor means no vitamin B12 transport, and unfortunately, the kind that ends in deficiency of vitamin B12. Clinically, this is often seen in older adults and it can occur with or without autoimmune involvement. Maybe H. pylori may also have a role to play. So we are still on letter A for mnemonic, and this time it implies acid suppression. Long-term use of acid suppressant drugs like proton pump inhibitors, PPIs, okay, can also contribute to B12 deficiency. I'm not saying short term. If you take PPIs for a long time, this is what I'm talking about. By reducing stomach acid, okay, through the PPIs, they do not only impair B12 release from food, but over time, they can inhibit or even atrophy the parietal cells. And this leads to reduced intrinsic factor. And that means vitamin B12 transport and absorption is going to be impaired. Now, B in the mnemonic implies bacterial overgrowth or blind loop syndrome. Conditions like bacterial overgrowth and blind loop syndrome can also lead to vitamin B12 deficiency. Why? Because when there is intestinal stasis, okay, like that, meaning slow or stagnant movement of gut contents, it creates the perfect environment for bacteria to multiply, especially in areas like a blind loop of the intestine. Some of these bacteria, like bacteroids, can actually detach vitamin B12 from the intrinsic factor and use the B12 themselves that is directly competing with the host human beings for this vital nutrient. So even if your absorption machinery is working fine, these overgrown gut microbes might be stealing the vitamin B12 before they even get absorbed. Now, the letter C in our medical mnemonic. So, we're going to talk about consumption, Crohn's disease, and chronic pancreatitis. Now, vegetarians are also at risk of B12 deficiency since B12 is found almost exclusively in animal based products. Without dietary sources, B12 stores eventually run low, so supplementation is highly recommended to prevent deficiency. Okay, regarding Crohn's disease, this often affects the terminal ileum, the exact site where vitamin B12 is absorbed. In fact, about one third of Crohn's patients have small bowel involvement, which can impair absorption and lead to B12 deficiency over time. So, in patients with Crohn's, especially with ileal disease or resections, B12 may be monitored. And chronic pancreatitis, the pancreas doesn't produce enough proteolytic enzymes. Without these enzymes, vitamin B12 stays stuck to the R binder as previously explained and won't transfer B12 to intrinsic factor. No transfer means no absorption in the ileum, and that leads to B12 deficiency. In rare cases, vitamin B12 deficiency can also be caused by parasitic competition, specifically from fish tapeworm Diphyllobotrium latum. This worm can settle in the gut and absorb large amounts of B12, essentially stealing it before your body gets the chance. This may be more common in people who consume raw or undercooked freshwater fish in endemic areas. And finally, surgical causes of vitamin B12 deficiency. Certain surgeries like gastric bypass or resection of the terminal ileum can also lead to B12 deficiency. By removing or bypassing the areas responsible for intrinsic factor production or B12 absorption, these procedures interrupt the normal pathway for B12 transport and absorption. Thank you, and I hope this was useful. If you enjoyed it, then hit the like button and subscribe to the channel. Bye.